Hello together. Now welcome to this video. Now mixing sample comments, plenty comments like online asking me lo tok lo signs na symptoms blo TB so sick tuberculosis. Now me can tok lo signs na symptoms blo sick TB. Now narap lo sick too, but me feel mosem. You may need lo understand them this la tupla word past time. You may need lo understand them one them a meaning. Now you may need lo differentiate between this la tupla word signs na symptoms. Okay, even though you may say use him lo how sick na you may say use him lo or something where come up those body blue me. Tupla words you can mean him lo same plus something, but actually tupla got different meaning. Na tupla mean different something. So first of all, by me asking this like questions, what are signs and symptoms? Okay, signs and symptoms can mean plenty something. If you talk about like weather, or if you talk about or narapla or something, you got plenty of signs and symptoms below can something. But in this video, when we talk about signs and symptoms in the medical context. Okay, in the medical context, definition of signs and symptoms, they are abnormalities that indicate whether you have an injury, an infection, or other medical condition. Okay, so signs and symptoms, by me talk about something where you come up with body blue me, or show you may got something sick, or you may got something wrong with them, health blue me. So in this video, me like you me by me define him, differentiate him, this the two words signs and symptoms, so that you may understand them. Before you may go talk about all signs and symptoms for TB or narapol sick. Alright, so you may start off with them symptoms. What is or what are symptoms? And one of some examples of symptoms. Okay, so symptoms by definition, they are subjective experiences that are reported by the patient. Okay, so symptoms something where doctor or nurse in on look him. But you now, you sick man, you patient, and you tasol by you feel him. Now by you report him go to doctor or nurse. So this is something where you feel him, now you report him go to doctor or nurse, and this la all symptoms. Okay, examples of symptoms and pain. You feel in pain like you feel in head pain or bell pain or chest pain. Doctor or nurse save how much pain you feel him. So I'm asking you how much pain you feel him, and by giving you one plus scale maybe from 1 to 10, and then by you describing this la pain where you are. So this la most pain where you feel him, you sick man you feel him, and come under symptoms. Number 2, I'm tired. By you feel him tired. Doctor and nurse, also feeling tired. I mean, also feeling tired too. But like I said, me talk. If you sick, na go lao sick. It's the tired where you feel him. It's the skinless where you feel him. And by you describe him, go to doctor or nurse. Number 3, I'm will call him also this the feeling where you got bell blue pain or bell blue tanim. You like trout, it's like kind. And it's like kind too by you talking go to doctor. Or sometimes by you sick man or patient and by eye round. And this la too and by describe him go to nurse or doctor. Like examples below symptoms you saw twin or you feel him less lo kai or you saw skin hot na you saw sweat lo night. Okay, so all something where you ba feeling most impatient or sick man ba feeling most impatient na ba report him go to nurse or doctor. So this is something all call him symptoms. Now you may talk about signs. So signs all objective experience. Okay, or objective indicators below sick or abnormality, or like me talk or something where come up the body where doctor and nurse all by look him or all by observe him or all by measure him lo how sick. So this is something all signs here. All something now where doctor and nurse by look him all measure him lo sick man. Now all something where it can be seen, it can be heard, or it can be felt during a physical examination or with diagnostic test. Okay. So signs something where doctor and nurse by look him, ball harim, ball feel him, na ball measure him, time looks him blood blue, na ball test him. And this now all signs. So example ball signs fever. So doctor or nurse can measure him fever blue by put him one blood thermometer, na by measure him body temperature blue. So time body temperature blue go above one blood reading, I can talk him you got fever. Now I'm one plus sign blow sick, one plus sign blow infection. For example, rash. So suppose you got like rash or skin blue, by doctor or nurse and by look him now and by talk him, or maybe you got some infection or skin blue. Something where doctor or nurse can harim and heartbeat blue. Ball use him stethoscope lol, ball put him lo chest blue, and ball harim heart blue beat. So suppose heartbeat blue and no sound straight, ball talk him you got problem with them heart blue. Narapla swelling suppose leg or arm blue or some body blue solap. By doctor or nurse or healthcare person by look him by talk him maybe this line sign of something wrong with them body blue. Na two or black sim blood blue na ball saling blood blue go to lab where by me lo lab bang test him na suppose sample results when come na abnormal soy mosem you got sample sick or you got sample something wrong with them health blue. So this la basically all signs and symptoms. So symptoms one something patient or you sick man you feel him now you communicate him go to nurse or doctor symptoms. Now signs or something a doctor or nurse or healthcare worker look him now measure him now find him out or some you got sick or you got something wrong with them health blue. So taso like definition explanation na examples for signs and symptoms. If you find this information helpful, like this video and share it, and do subscribe to my channel for more health educational content. And in the next video, we'll talk about signs and symptoms of TB or tuberculosis.